Hello, I am nurse practitioner Abby, nurse practitioner here at Integrative Medical of Rockford, here with another integrative chat. Today, I wanted to chat with you about migraines. Those headaches that sometimes come out of nowhere. Sometimes you have a little bit of warning, but those are the ones that are terrible. They ache, they hurt, they pound. For some people, they have trouble with nausea. You have to turn off the lights. Those are the headaches I want to address today. And I want to look at it from the way I approach it in the office here at my practice. So, if you are diagnosed with a headache, all the testing has been done, and we know it's nothing else but a migraine, I like to take several approaches to the treatment. First, I like to do some additional testing because the more information I have, it helps me be able to help you as a patient better. So I like to go for MTHFR to check for how well you're methylating. I want to check your homocysteine levels. And then I check for allergies to the environment, to foods. And then coupled with that, I also test for sensitivities to certain foods. Now, allergy and sensitivity are two different things, and I covered that in a previous topic. So by all means, go back and learn the difference between the two. I also want to check for your magnesium level, your red blood cell folate levels, and then for celiac. Studies have shown that many people who have migraines have celiac, and sometimes it's probably one of the last things you'll think to look at. So there's always a celiac conversation that I have with my patients. Then I want to look at the diet. So for many patients, they would have a journal, and that's always recommended to track the foods that you're eating and see which foods may cause this migraine. That is different than the sensitivity and allergy testing because those ones, the allergy and sensitivities, they are more an immune system response. So I'm not really talking about that. When we get the results from the allergy and sensitivities, we want to go ahead and eliminate those foods because we don't want them to wreak havoc on the body any longer. But we also want to remove foods such as chemical sweeteners. We want to remove some seasonings such as MSG. And then we also want to get enough protein. So that's something that I always tell my patients, make sure you're getting enough protein in your diet. I also tell patients you want to be very well hydrated. So we looked at testing, we looked at diet. Now let's look at lifestyle. For many patients and many people, they cannot sleep, and sleep often results as a trigger for migraines. So I tell my patients, let's take a look at sleep hygiene. How well are you sleeping? And then figure out ways that we can help the sleep process go better. So does it mean turning off the electronics a little bit earlier, having a great bedtime routine to get that sleep in? That's very important when we're addressing migraines. Then I also want to address stress because stress affects everything. So there's a really great stress protocol we can go through, and I give patients tips on how to address their stress. So the next thing we look at would be supplements, or I call them nutraceuticals because I am using them to treat a certain condition. One of the things that I like to treat first would be the mitochondria. And I talked about that the last time. That's the energy system of the body. And I like antioxidants such as CoQ10 and alpha lipoic acid. They're really good for the mitochondria, and then also some magnesium. And then you want to look at certain B vitamins. B6 is excellent. There's probiotics, there's vitamin D, and then mood stabilizers. If you are someone that battles with anxiety or depression, there's some natural things we can do to help with moods. Now, as always, there's the option of medication if you want to treat your migraines, but I also have other tools in my toolbox that I can use to help you. And for those ladies, for some ladies, migraines come during a certain time of the cycle. So for that, you can either do a hormone panel to check for that, or if you know that the progesterone is causing it, sometimes you can supplement that as well. It just depends. Here at Integrative Medical of Rockford, I strive to get to the root cause and to find ways that I can give you a holistic approach to your healthcare. So when it comes to migraines, it's not so much just doing one thing, but I look at all the different things that we can do to get you feeling better and for you to have less migraines, or I should say more migraine-free days a year. I am nurse practitioner Abby. That has been an integrative chat. If you'd like to chat with me about migraines or anything else you're thinking about, call the office at 779-423-2044. Have a great day.